Welcome to my podcast. I'm Dr. Chai Ling, and I will be guiding you through today's enlightening conversation. Our esteemed guest, Dr. Annabelle Chow, brings her expertise as a clinical psychologist from Singapore to explore a vital topic: lifespan of wellness, women's mental health from periods to pause. We're diving deep into mental health journey women face from menstruation through to menopause, unraveling the psychological impacts at each stage of this natural continuum. Dr. Chow, renowned for her holistic and empathetic approach to therapy, will offer her insights on how these life phases can influence women's mental well-being and discuss strategies for support and resilience. Join us as we bridge the gap between physical health and mental wellness, shedding light on this crucial aspect of women's lives with Dr. Annabelle Chow. So welcome, Dr. Annabelle Chow. I just wanted to have some questions about both menstruation all the way to menopause, because I see a lot of women in my clinic, and I find that mental health is one of these issues that we don't discuss very often. Yeah. Do you see a lot of young women where on the onset of menstruation, they start having some mental health issues?
When we talk about mental health issues, it's really like a broad spectrum.
Yeah.
It depends on whether you're experiencing some symptoms sometimes.
Right.
So in the context of the menstruation, right, I think when the menses is coming, they will feel like, oh, I'm a bit uncomfortable, I'm a bit like, I feel sore here, my body's aching there, a bit more irritable, I'm a bit more teary.
Okay.
And I get more, like I have less patience for people and I just want to be by myself.
Okay.
But that's not necessarily a disorder. I think it's just, having the premenstrual kind of warning signs. That's what I tell them. But it's not so much that the symptoms that's the problem, it's more how we manage. So I think all of us will have some premenstrual symptoms, like you'll feel more tired, more exhausted, your mood will get a bit more irritable, you'll be more teary, you get stressed a bit more easily in the few days. And I also explain to them that there are hormonal changes happening for you, right? You've got different levels of estrogen, progesterone, and all these have an impact on your mood. But this doesn't necessarily mean it's a mental health condition.
Okay.
So unless they are extremely teary all day, every day, their appetite is affected, their sleep is affected, they got feelings of hopelessness or life is meaningless, they're teary all the time, they can't go to work, can't go to school every day for at least 2 weeks, that will be what I call depression. That's a mental health condition.
Okay. So when it affects like school or their normal daily lives?
Yes, so they need to be dysfunctional in one of the areas of their normal functioning. So either school or work, or even with relationships.
Right.
And playing truant, for example, or having to throw in MC 1 or 2 days will not really count in that sense. It needs to be quite persistent.
Okay.
So we're looking for patterns of behavior here.
Okay.
Yeah.
Okay. That's quite interesting because, I actually have some young patients. I think they are quite high functioning. They tend to be from good schools. They come and see me for aesthetic purposes, things like hair removal. But I also noticed that when they have hit puberty, they started getting thinner and thinner. So I have this one patient in particular that I thought she was developing an eating disorder. But when you ask her about how she's performing in school and her ballet lessons, she is a high performer. So how would you classify that as sort of a mental health issue?
Okay, so it is actually consistent. People with eating disorders tend to have perfectionistic and super high functioning, super high striving, achievement type kind of personalities. So they are quite all or nothing. But that also doesn't necessarily mean that they have an eating disorder. I think we still need to take the history in terms of the eating habits, whether it's binging, purging type or restrictive type, how much they're exercising and things like that. So I think they still need to be assessed holistically.
But do you find that when a woman, when a teenager hits like their menarche, do they have a higher risk of eating disorders?
Yes, primarily because our body image is actually something that affects our confidence.
Yes.
And once we hit puberty, we have acne. Once we hit puberty, our body changes. We can have bigger boobs, or we may not have bigger boobs, but our friends have bigger boobs.
Right.
Then there's comparison, you know, you look at somebody else, you look at yourself. People grow taller at different heights. You might put on a little bit more weight. So there are physical changes. There are also a lot of hormonal changes. Teenage time, puberty time is also the time that they are trying to understand themselves better and find their own identity. It is a period of time that it's a bit more stressful. People are judging me. I don't really know who I am. I don't like how I look. I never used to have acne. I have all this acne. I still have to deal with schoolwork. I still have to deal with my family. I still have to deal with my friends, my CCA, and there's just so much on their plate.
So it's sort of like a double whammy. It's difficult enough being a teenager in this age of social media. Then there's really the hormonal aspects that it really will wreak some changes in a teenager's brains. Right, so going through this menstrual cycle, is that why? Do you find that you see more teenage girls than boys having mental health issues?
In the past, I would have confidently said yes, but not in recent years. I think it's quite an even distribution.
I see.
And my hypothesis will be probably like increased awareness of mental health conditions, more normalizing and destigmatizing of seeking help. And traditionally, we always think about body image issues to be related to women. But actually, in recent years, the wave has also started shifting. Actually, men are also equally concerned about their physical image, how they look, and it has quite a bit of impact on their confidence and self-esteem. And I also have male clients who actually are very much into makeup. So they put on makeup to leave their homes, and if they don't have their makeup, they won't leave. So I think it's a bit of an even distribution today.
But actually, that's quite interesting. But I personally, when I was a teenager, I didn't think I had a mental health issue, maybe because there wasn't such great awareness. But I remembered every time before my periods, I would actually get symptoms. I actually felt, apart from being bloated, I thought I was more irritable. To the point that sometimes I almost feel like I have panic attacks. I almost didn't want to go to school. But I guess maybe in those days, you know, you had less options. So I wondered, I mean, do I have a mental health issue? Or is this like not big enough to see a doctor, but we should be aware and do something about?
I think we should definitely be aware and be equipped to manage. So I think hormonally, right, during the menstrual cycle, we'll just focus on estrogen. So estrogen actually affects the development, or actually affects the neurotransmitter called serotonin. So serotonin is actually what we call the feel-good hormone. And this feel-good hormone actually regulates our sleep, our appetite, our mood. So things like chocolate, they have high serotonin levels. So you eat, you feel good. Low serotonin levels, like very low levels, have actually been associated with depression. So actually, if you look at the menstrual cycle, right, when the period of time that is premenstrual and we're feeling bloated, we're starting to have the PMS symptoms, that's actually when our estrogen levels are pretty low, which correlates to our serotonin levels being low. And if it's low, it means that we are going to be more irritable. Our mood is going to be lower. So in that sense, it's actually a very natural hormonal change that is happening in us. Sometimes my patients say, then my family says that's an excuse. My boyfriend says that's an excuse. But it's not an excuse, it's science. It's hard science, right? It's exactly what's happening. But perhaps what we can do is to equip ourselves in handling that. So simple things like keeping a log, right? Like having a menstrual calendar so that you can plan ahead. So for example, you know that you're going to get more tired. You know that you're going to get more irritable. I will not recommend having lots of social activity, especially in the first couple of days when you have your period, right? Because that will just tip you over. You know, you're already tired, and then you've signed yourself up for like 10 parties in 2 days. You are killing yourself, right?
That's
so
true.
I would recommend like keeping a log, and then also figuring out what are your down days. So some people's PMS symptoms happen like 2 days before, some people get it a week before, some people just get it a day before. Everyone's different. So once you have that log, you have more clarity. Then you can plan your schedule and how much rest you need. The other thing is deepening the understanding of yourself. So for example, if you're an introvert, it means that you need to be by yourself to recharge. So on the days that I know I'm going to be more under-resourced, I will try to be by myself to recharge. So which means after school, after work, I think, let's clear the calendar, go home. But if I feel like I'm actually an extrovert and I gain energy by being around people, then sure, if you feel like those 2 days, if you go home and be by yourself, you'll be lonely, you'll be more teary, then don't do that. Organize to meet your friends.
Okay.
So it's not like a hard and fast rule, but understanding yourself a little bit better helps you plan what works for you.
So it's almost like having strategies, but there's no one size fits all, right? So
Absolutely.
yeah. But what you said about the chocolate is very true, because I do actually have cravings for chocolate before, the menses start. So maybe that's my body's way of telling me that,
Absolutely. And I always remind everyone, the body is constantly sending us messages to tell us what the body wants.
Yeah.
And most of the time, we don't actually read the messages. Like, so for example, when we are yawning, it means actually it's time to sleep.
Yes.
But what do?
Yeah, we take coffee.
Yes, we take coffee, or we procrastinate our bedtime because we want to finish watching this Korean drama or finish watching Netflix. But actually, it's a sign that our body is telling us we are tired, it's time to rest. Or even when we are thirsty, actually by the time we acknowledge that we are thirsty and we need a drink, we are probably already dehydrated an hour before. The body communicates with us this way to increase chances of survival.
I see.
In the same vein, our body communicates signs to teach us or to highlight to us that, hey, anxiety, depression, or like feelings of, even not depression, like feelings of low mood, right?
Yeah.
It is to inform us to have an action plan.
Okay.
So for example, I have puberty and I've got a lot of acne happening and you feel anxious because people might judge you. Your body will also start to communicate with you through physical symptoms of anxiety. Like, your breathing might become faster and more rapid, your heartbeat might become faster, you might have sweaty palms. It's your body's way of telling you, hey, you're feeling anxious. You need to do something about the anxiety. Something in your mind is telling you that this is dangerous. Being judged by people is interpreted to be dangerous in our brain.
Okay.
So we need to address it.
I see.
So our body is constantly communicating with us. We just need to be a bit more mindful of it.
So like for all your women who maybe come to you with a bit of feelings of low mood, and maybe it may or may not be associated with the menstruation, are there like simple tips you give them that can help combat this? I don't know, some kind of diet or exercise, or avoid alcohol when they're feeling low. I don't know, some people say drinking can alleviate these kind of feelings, but I wonder if actually sometimes it makes it worse,
Okay.
Yeah.
So the 3 basic foundations that I will never compromise, and I tell everybody, we cannot compromise on these 3 things. One is sleep. We must have minimum 7 hours sleep. Okay. And this 7 hour ideally needs to happen before 12 p.m.
Okay.
So actually it's an experiment you can try. If you sleep before 12, even if you go to sleep at 11:30 and you sleep for 7 hours, then you sleep at 12:30 and you sleep for 7 hours, you might notice that you're not going to be as well rested as if you had slept before 12.
I see.
Yeah.
Okay.
So you must have 7 hours of sleep. 2, you must eat nutritious food. So no junk food. I mean, not no as an absolute, but reduce junk food. So even like our HPB with the food pyramid, even we just follow that. But the key word is balanced diet.
Right.
You need to have a balanced, nutritious diet because you are what you eat. And if you eat well, you can sleep well. If you eat well, you don't feel bloated, you don't feel indigested. You sleep well, your mental health also follows. And then the last one is exercise / movement. I've moved away from purely exercise because I also understand that sometimes, a lot of times my patients say, but I have no time. I'm a full-time working mom, I have 3 kids, I cannot go exercise, it's just not possible. Then increase movement. So take the stairs if you can, don't take the lift, don't drive to your nearest convenience store, but walk. So if you have these 3 basic foundations, you actually look after your physical self.
Yes.
And just think about the day that, you probably slept really late and you wake up really tired. Naturally, we're actually more irritable. So this is not even like that we have a mental health issue. This is just being a human being, right?
Yes.
I remember when I was nursing through the night, my children, I was sleeping in less than 2 hours of disrupted sleep cycle. And then every morning I wake up, I have to pass my baby to my helper. I have a good 40 minutes of quality sleep. Then I wake up and I prepare to go to work. Then my husband always asks me, why is your face so black?
Yes.
Because you were snoring.
Oh,
I didn't sleep, right? Don't ask me that question.
Right, yeah.
So if you don't sleep well, you will naturally be more irritable. And when you're more irritable, it will affect your social network. Because you will actually be more irritable at people, you will lash out at people more, or you will be more resentful towards the people that you're working with or you're surrounded by. Because they'll say something, you have lesser capacity to handle it. Right? And then you either explode or you suppress and explode later, of which either ways are not healthy ways. If you don't sleep well, you cannot concentrate. You cannot work, you cannot deliver your work, you're going to be behind, you're going to be stressed, then you'll be thinking, I need to manage my stress. And so the cycle just kind of...
So it's a knock-on effect.
Yes, absolutely. So those three basic things, I say cannot compromise. We move beyond the three basic things, we need to deepen the understanding of ourselves. So have a toolbox of strategies that can be used interchangeably, but it must be based on your own preference. So get some consult in terms of like what the options are out there, right? So as psychologists, we love to recommend breathing exercise. Primarily because the breath is something that you take with you anywhere and you don't have to carry it with you, right? So breathing is one. Listening to music, meditation, exercise, I talked about that. Finding a hobby that you enjoy, reading, listening to music, playing music. You know, doing, like figuring out what kind of things reduce your stress levels and help to increase serotonin.
So do you also actually recommend to your maybe women and teenagers to disengage from social media?
Yes, so I would actually recommend social media fasting. So I always remind people, actually social media is not really the problem. The problem is how we use it. How often we use it, when we use it, what we use it for. Because there are some social media sites that are actually really helpful. People can get parenting tips from it, albeit must be from someone that is, you know, a professional, for example. But it's not so much that social media is the problem, but it's actually how we're using it. So if we're using it to compare ourselves, and we have a lot of envy, like, oh, you know, my friend looks like that, or this celebrity looks like that, and why don't I look like that? Or they travel there, and you know, I can't afford to travel there. Then it will take a hit on your mental health. Right? Then I think we need to take a step back and be more aware that the way that we are using it is actually affecting the way we start to think of ourselves and the people around us. It has an impact on how we react towards them and ourselves. And maybe I need to think about how to limit my usage, or what kind of social media sites I'm actually subscribed to.
I see. Is there like a limit to the number of hours we should be using our social media? Because, you know, after a while, you're desk scrolling. So, you know, how do we actually know we are too much on social media?
I wouldn't go with a number of hours. I used to, but then I realized that it also depends, because our younger generation, a lot of them are content generators. Actually, their job is to scroll social media. Or like, depending, right, if they do marketing and all that, that is actually something which is that part of their job scope. So I think the measure that I say you have to stop is when you're mindlessly doom scrolling. It's just a mindless thing. It's actually, you could have used the time to do something else, but you have nothing to do, or you're too tired to do anything, you don't know what to do, you mindlessly take your phone out and then you're just scrolling. So then that's the point that I will say, be mindful of that, stop, put it down. Ask yourself what are you feeling now? If the feeling is, I'm feeling bored, is there something I can do to address my boredom? Or do I actually really need to do something to address my boredom? Or actually, am I okay to sit and be bored and be with myself now? But, you know, being more understanding of the feelings that is driving the behavior will help to inform the next healthier step to take.
So there's actually a lot of reflection that one has to go through, isn't it? I mean, when we're younger, we don't even know there are these strategies to identify, oh, maybe we're not feeling so good, we have to sit back and think about whether these habits make us happy or unhappy.
Yep.
So how do I know? When do I need to see a psychologist?
You don't actually need to experience a mental health condition to see a psychologist. So as a clinical psychologist, I see the whole range. This range at the end of one spectrum is when you meet diagnosis for a mental health condition. But let me give you some examples of people who do not meet any mental health conditions who can't see me. Okay. For example, life transition. You followed your husband, you relocated to Singapore, you cannot adapt to the culture, you've lost your friends, you've lost your identity, you don't know anyone here, there's a lot of adjustment difficulties, and you need to speak to someone to make sense of this and to grieve over the loss of that. Or a death of a family member, for example, who's very dear to you, or a death of a pet who's very dear to you. You're not crazy or anything, but you just need to seek professional help in terms of how to make sense of the grief, how to cope with your everyday living, right? Or even like if you're being bullied in school and you just need someone to talk about strategies and make sense of that. That's also not crazy. It's not even on the mental health disorder spectrum in that sense. Or we have people who want to learn to be better versions of themselves. So they say, you know, I want to improve myself as a person. I want to develop more compassion. I want to develop more certain types of values. Can we work together?
Okay.
So firstly, you don't need to have a diagnosis to see a clinical psychologist. Secondly, I think when you know that you have a mental health condition, the first telltale sign is when you are dysfunctional in one area of your life. So for example, your social functioning. You find that every time you try to have conversations with family, with friends, with colleagues, any kind of social interaction, they usually combust. And if there's a persistent pattern of that, it shows that there's something dysfunctional about your social relationships. Or if you find that it's difficult to actually maintain your employment history or stay in a job, or actually even go for your, attend and turn up for work. That's another sign. In the same vein for school. So if any of this is a significant collapse, then I'll say don't wait. Definitely see a psychologist.
Right.
The third one is if you are not sure, but you have feelings, you have thoughts, you can't make sense of them, you don't know what to do with them, see a psychologist.
Yeah, because I think in the past, maybe from my era, and I'm a doctor, there's some stigma, that you must have a clinical diagnosis of like a depression or anxiety to see a psychologist. But when I gave birth, I thought that, I'm not really going through depression because I could go to work, maintain employment, but I definitely didn't feel myself. First of all, I didn't look like my previous self, so I put on some weight, and I also had difficulties coping with the additional pressures of having kids and work. And I actually thought to myself, I should be happy having this baby, but sometimes when I look at the baby, I wasn't so happy and I felt guilty.
Yes.
So I didn't dare to tell anyone, but I wonder, if seeing someone would have helped then.
That's a super normal experience.
Yeah.
Like you, I put on 25 kg from having my second child. I was hopeful when I delivered that a lot of it will just come with the baby.
Come all out, right?
Right? Turn out 4 kg baby, 1 kg placenta, or 20 kg on me. And like you, right, when the baby arrived, I didn't have a sense of, I love you so much. And the doctors in the hospital kept saying, I think you have depression. And I'm like, dude, I'm a psychologist. I'll tell you if I have depression. And he went, oh, all psychologists think that they don't have depression. I'm like, I do not have depression. I'm sleep deprived. I haven't gotten to know this, honestly, this blob. Like, I don't have a relationship with him yet. I'm in a lot of pain, and really, my hormones are raging and they haven't really stabilized. This is what I would call like post-baby blue and some anxiety, and it's really, really normal. Up to 80% of women experience post-baby blues within the 2 weeks of delivery. People think that's depression. Depression, if your symptoms persist, so symptoms of teariness, symptoms of thinking of wanting to die, symptoms of feeling that life is meaningless, sleep, appetite, all affected, right? Then if you meet criteria and then you persistently feel this every day for 2 weeks, then I would say that yes, you must get yourself diagnosed because you may be depressed.
Okay.
But there is a difference between post-baby blues and depression, and we can actually see a psychologist to talk about it to get more support.
Okay.
And even for post-baby blues, you don't necessarily need to see a psychologist. You can just get more support and understanding from family and friends.
Right.
Yeah. So there is a societal expectations that all mothers will immediately love their babies.
Yes.
You know, you see those social media.
Yes.
The baby comes out, everyone's crying. I was like,
Yes.
oh my god, I love my baby. When my baby came out, I was like, I didn't have that.
Yeah.
I actually passed my baby on quickly because I said I'm going to vomit. And eventually I vomited on him.
Oh,
so it was nothing magical or beautiful.
Yes.
But nobody prepared me for that. Everybody said, oh, you know, you must love your baby so much. Congratulations. And I'm like, okay.
I think also because, well, at least for me, I got a lot of my first baby, at least, a lot of expectations from social media. So I thought that I was supposed to look beautiful after, which I didn't. I was supposed to love and cry when my baby came out, which I didn't. I was supposed to be able to fit into my pre-maternity outfits when I left the hospital, which I didn't. I left in my maternity clothes. So all these expectations, you know, maybe made me feel less of a woman. Also, the thing that I was able to sprout milk whenever they want, like a cow, and like have liters of milk, which I didn't. So that just also made me feel less of a mother, less of a woman. And I think maybe I wasn't having full-blown depression, but I would definitely want to know what are the avenues for support for somebody like me.
So I think firstly, there's a lot of societal expectation placed upon new mothers and a lot of internal expectations of mothers that we place on ourselves as well. That is the part that can cause us to feel very guilty, very depressed, very anxious. I think we need to be aware of that. So firstly, we want to problem solve, right? So if for example, breastfeeding is a problem, then the first recommendation will be go and see a lactation consultant because we want to see if that's something that we can be resolved using a professional in that area. Is it just a technique, or you know, is it a diet? Is it stress? Because stress can affect your ability to breastfeed. So once we get these things ticked off and you are still feeling on that, then I'll go broader and think about, okay, environmentally, what's happening? Do you have explicit and implicit messages from family and friends that you should or should not do certain things?
Yes.
And then that's the point that I will either talk to my husband but it doesn't necessarily always have to be husbands, because I've got patients who come in and say the husbands are the one who is applying pressure. So pick a trusted person who is like your person, right? Can be a friend, can be a family, and talk about how you feel. The reason for that is we are all like jars, right? Everything that we experience that causes us stress just kind of adds into the jar, right? And your jar just gets filled up. So talking to someone that you trust, someone who is non-judgmental, someone who is safe, someone that's not going to tell you you should do this and you should do that, but it's just really there to listen and provide comfort, helps you empty out your jar. So when you empty out your jar, you also have a little bit more clarity of mind to make decisions. Again, the basic foundations. Are you sleeping enough? No new moms sleep enough, right? So try to get as much rest as I can. Are you eating well? Are you moving at all? And if you have done all of this and it's still persisting, then I would recommend seeing a psychologist. Again, it doesn't necessarily mean that you're depressed. And in fact, most new moms, when they come to me, the number one issue besides the struggles with breastfeeding is in-laws. I'm very stressed. You know, I was trying to breastfeed in the living room and then my in-laws didn't tell me. They just suddenly rocked up. I don't know how to tell them I cannot deal with this. I don't know how to tell them I don't want the relationship to break down. You know, I know that they're excited to see their grandson, and that's the most common struggle. And it's just even equipping them with skills of assertiveness, how to negotiate, how to draw boundaries, how to get support from your husband, talking through all this, rehearsing with them. So it's like skills acquisition and giving them a bit of courage to go and try and do it. So when you can change that issue, it would also have quite a positive impact on your mood.
I see. And of course, talking to people who have gone through the same transition or this phase in life also makes you feel like you're not alone and you're normal, right?
Absolutely. So finding communities, we always say it takes a village to raise children. I always say it takes a village to raise mothers, to raise parents, because last time my grandma's time got kampong to help, you know. But now we all live in nuclear families. We don't really have that same kind of degree of help. But also there's a wealth of information out there. How would I know what is right and what's wrong? How to decipher, right? But if you find yourself a non-judgmental, safe community of support, the support doesn't even necessarily need to be 20, 30 people. It can be anywhere from 1 to 2 to 3. And you know, you trust these mothers who are going through the same things, or your friends who are mothers before you, to get some advice. The only thing I would recommend is don't take people's advice as the only way to do things. Because that can cause a lot of stress too. But take on people's advice and consider if it fits. Get support by talking to people about your situation and to let them know what you need. Right? Actually, I don't need advice. I just need a listening ear. So signpost it, right? So that you can keep the community safe too. And actually, social media is very helpful for this. So I remember it was very lonely for me because I was one of the early mothers in my friend group to have a baby. I only had one other friend who had a child before me. So I tried to join social media groups to have, you know, just even read, you know, what people are posting and get more information. And that itself was helpful. Because you would have a question that somebody else would have asked. It gives you a bit of an idea. And you don't feel that you're so alone. I once did a shout out. It's 4 a.m. I can't get my baby to sleep. Anyone still awake? I got 89 comments.
Oh my God.
In like 5 minutes. And then suddenly I felt like I'm not alone anymore. Because it's so lonely at 4 a.m. doing this by yourself.
I know.
And even that camaraderie helps to have a positive impact on the stress levels and your mood.
So social media can really be a double-edged sword. Depends on whether you want to, you know, follow the, what they call the influencers and believe that you have to reach all these expectations, or if you want to reach out to a community that can support you.
Absolutely. So it's how you use it.
How you use it. I mean, there are really problems that women experience. I think it's actually not easy being a woman, especially in the modern times when you are trying to balance work. Then there's social media where women are so beautiful and so successful, but they also have children and they're never depressed. So in your practice, when you see women, are there like particular age groups they are higher risk of depression or anxiety?
I think that anyone is susceptible to depression. Anyone in any age group, because it's dependent on resources, dependent on your genetics as well. There's some degree of hereditary kind of genetics there, but also depends on the crisis, right? And everybody will have some degree of crisis and challenge in our lives. So if at that point of the challenge that we are facing, but we have adequate support and resources, we can see someone, we can talk to someone about it, we get good love and support, right? Then of course it reduces the chances of us developing into depression. But if you're alone, and you have a lot of pressure, and actually super high functioning professionals find it very difficult to seek help as well, because it's just like a different challenge, right? The high functioning professionals are very concerned that people know that they're seeking help, that they're seeing psychologists, because they are worried about a reputational damage, that it will have an impact on how people perceive my ability to do my job. So that's the high functioning professionals. Then you've got at the other end of the spectrum who feels like, I got bigger problems, like I need to pay bills, I don't have extra money to go and see a psychologist, I need to put food on the table. But any ends of the spectrum, or even anywhere in between, we will have different sets of circumstances and considerations to see a psychologist. You know, and the other phase I find beyond pregnancy, which a lot of my patients face, is
when they come to menopause, it seems like it's another transition that they have to battle through, but this time with a lot more stigma, because when it comes to menopause, it almost seems like they don't want to tell anyone because they are ending a phase of fertility and youth. So they don't talk about it a lot. Nobody talks about menopause.
Yes, I think you're exactly right, because it has a direct impact on their identity.
Yeah.
Because as women, we are associated with fertility naturally. Just a bit like puberty time as well. It's also an identity problem, right? In the same vein, you know, with menopause, the identity changes.
Yeah.
Right. And there are a lot of physical changes that comes with it.
Yeah.
The memory issues is one, the brain fogginess is another, the fatigue is another. Then here comes the mood issues, right? Where they're very, very irritable. And then the family members will say, you are crazy. You're being very mean now. Like, you know, you're this new monster that, and these are actual quoted words from like families, right? You're this monster that I've never known what happened to you. But I think that there is a lack of education when it comes to menopause.
Okay.
In the same vein, right, with menopause, our sleep gets affected.
Yes.
Same equation, right?
Yeah.
If we don't have good sleep, we're going to be more irritable.
Okay.
And with our hormones changing,
Weight gain.
and we don't have enough estrogens, any kind of trojans is lacking in us. That has a direct impact on our mood and how we actually even look. We are also tired all the time. Right. So that itself would also sometimes make it difficult for the woman. Firstly, in my experience clinically, they don't even know they're going through menopause. Families don't even know they're going through menopause. They just think my mom is crazy. Right? And she's just become crazier. But if you take a history and you match the age and the symptoms, I'm like, she's going through menopause. When we are educated on what we are faced with, then I think it increases resources and empathy to handle it. So my mom is crazy versus, oh, actually she's having menopause, she needs help. Takes a huge radical shift in the attitude towards that. So I think firstly, a lot of education about it, the symptoms, the signs, you know, the consequence, and actually why. Why, you know, why these symptoms happen. You know, if all your hormones are low, then naturally the other very common thing is there's a lot of vaginal dryness. Sex life takes a hit. Right? Marital problems come in. So all this needs to be educated.
I think, you know, the stigma is very real. In fact, you know, I just wrote a book on menopause last year, and it all came about because one of my patients, and she is this high-flying banker from Hong Kong, she is single, I mean divorced, and back on the dating scene, and she was on Tinder. So she's about in her 50s, and she met this really interesting guy. They chatted for a few days, and one of the first questions he asked her when they were chatting on Tinder is, are you in menopause? So it almost seemed, and so when she came to see me, she wanted to do all these treatments for herself to look beautiful, because I think it almost seemed like men viewed menopause as aging, you know? And I think that's the stigma. So a lot of women don't address that.
Lack of education.
Lack of education, that's true. I also had a patient that was really depressed. She was so depressed, her husband thought she was going to be at a suicide risk. So she was put on Prozac and some antidepressants, but it didn't help. Then for another issue, she was put on HRT. And straight away, her depression actually alleviated. So for women that perhaps don't have this option of going for HRT, because really it's just reserved for women with menopausal symptoms, are there anything we women can do? Because, you know, this whole menopause, it isn't a sudden thing. You are in perimenopause for several years. So sometimes your periods haven't ended, but you are already feeling like cannot remember stuff. You're not feeling, you're not feeling quite as, maybe your sex drive has also started to go down. It can be a decline for maybe even 5 years before you actually hit menopause.
So first thing I would 100% recommend is get yourself educated on the menopause process. You're absolutely right, because that's actually something I'm doing in clinic with my patients. They don't have awareness that it's like a progression. They just think that, oh, the sign that tells me I'm in menopause is when my period stops. But then you've been having hot flushes for many months now.
Yeah.
You've been increasingly irritable. You have been having difficulties initiating sleep. Has anything else in your environment changed? Nothing. There's been no significant change or crisis.
Yeah.
Have you considered that you are actually, perimenopausal?
Yes.
No, I haven't, but I still have my period. So I think women ourselves may not necessarily understand it.
Okay.
Right? So I think first thing is education.
Okay.
Second thing is then go and get the help that we need, right?
Okay.
So for example, if I am having difficulties sleeping, then I want to address that, right? What is causing my difficulties in initiating sleep? Do I have a healthy sleep hygiene? Maybe last time I'm very lucky, I don't need one and I managed to sail through life and I hit the bed, I can fall asleep. But now, with the hormones changing, you have this challenge.
Yeah.
Let's think about how we can support the sleep difficulty.
Yeah.
So what's going to help you fall asleep easier or fall asleep better and maintain your sleep?
Okay.
So if we can address the sleep, it can also help with the irritability.
Yeah.
Hot flushes, we can make the environment a bit more comfortable, right?
Yes.
Do you bring portable fans?
Yeah.
I'm not menopausal yet, and I bring portable fans.
Yeah.
I not only have portable fans in my handbag, I have them in my car.
Yeah.
And I live in Singapore. I need those fans, right?
Right.
So creating an environment that is more comfortable for you. If it means that you have to take spare clothes with you, do that.
Okay.
Because one common thing that they say is they have armpit patches, then they feel very embarrassed, but they cannot stop. So there is a discomfort of the actual sweating, but then there's also the embarrassment that people are judging them and they're not attractive, they're grimy, they're not clean, they're not hygienic.
Okay.
We can't stop the hot flushes per se because it's hormonal, but we can manage the consequences of that.
Okay.
So in some sense, when we understand which symptoms they're experiencing, we can also start to get a bit more strategic and creative in helping to manage those symptoms.
Okay.
So while I cannot alleviate the pain associated with menopause, so pain is as it is, right? It's given, which means everyone who is menopausing will have these symptoms.
Yeah.
It's something that we have to go through. But I can alleviate, and all of us can alleviate the suffering that is attached to menopause. So suffering comes in a form of not accepting that I'm menopausing now, not accepting that I have hot flushes, not accepting that I need to make changes to my life, I have to bring more things, with me. Those things will cause you to feel more irritable, more upset, more anxious, and will have a direct impact on your quality of life.
Okay. In fact, I just had a session with one of my patients, and she literally broke down in my consult room because I think she was going through perimenopause. But what I find was that she's really in a sandwich generation, which I think I am too. You're taking care of older parents and your kids are just becoming teenagers, and like you said, teenagers also have their mental health issues. So her daughter is suicidal or having suicidal tendencies, and her parents are in poor health. So there she is thinking she has to cope with everything. But when I saw her, I think she's the one that needed help. So for somebody like that, is there anything they can do? I mean, sometimes we don't even have insight. I mean, I don't even have insight if, I should be doing something for myself.
You bought a plane, and then they say, in case of an emergency, oxygen mask drop. Please wear your own oxygen mask before you help the person next to you. And that's exactly the advice. Because she's a caregiver. And there is caregiver fatigue because you're tired. There's caregiver burnout because you're at it all the time. There's caregiver guilt. So how can I go take time to look after myself if my daughter is struggling and my mom is in poor health? I should be with them, right? But if you don't look after yourself, you're a battery that's completely drained and is running on nothing. So it's about first you need to focus on yourself. Then two, I also get the same thing about focusing on myself. I have no time, I have no resources, I cannot do it. Understandably, everybody got different circumstances. Then I go into two. Are there resources that you can tap on? So if it is a family resource and the family, you're lucky, you have a family that everyone chips in, can help out with someone or something, great. Have a family meeting, talk about it, make arrangements. So logistical, right? If unfortunately you don't have family help, pay for help. If you cannot afford to pay for help, then go look into community services. Caregiving SG is a great resource, but basically there are many community resources that supports caregiving. So for example, if I take dementia as an example, you don't have alone time if you're looking after someone with dementia, because it's 24/7, right?
Yeah.
But there are resources where you can leave your family member in a center, and they can look after your mom or your dad for a few hours, or you can hire people to come in, or they have like befriending services that can come in.
Yeah.
There are paid ones and there are the social sector ones.
Yeah.
So get ourselves equipped with the
Okay.
resources out there.
Okay.
Right? Then 3, I think we also need to have awareness that we can't do it all by ourselves. Right? That it is okay to be stressed. It's okay to have feelings of tiredness, fatigue, feeling like it's meaningless, questioning meaning of life, questioning my own purpose. It's really normal. See a psychologist.
Okay.
Because it sounds to me that your daughter needs a psychologist. If your daughter is suicidal, go get professional help.
Yes.
Do not wait.
Yeah.
Right?
Yeah.
People have a misnomer that, if she's suicidal, means she will go into IMH. I don't want my child to go into IMH. I don't want a hospital record.
Yeah.
Go see a private psychologist, right? But see a professional.
Yes.
The psychologist will work with psychiatrists, so they will also advise as well whether your child actually needs medication.
Okay.
Right?
Yeah.
And not all clients who see us need medication.
Yes.
Sometimes they don't.
Yeah.
But then if someone is looking after your daughter, is sharing the burden and sharing the load, sharing the struggle.
Yeah.
In the same vein, can your mom's poor health be supported by additional help?
Yeah.
And then for this client, I think it's about her talking to someone in a private space, emptying out, finding strategies, talking through her guilt, processing her guilt, and have the psychologist help to flush out some unhelpful thoughts that she's having that's causing her suffering.
I see.
Like, I should be there. I should not have time to myself. So these are all non-sustainable, unhealthy thoughts.
Yeah, unfortunately for this client, which I've seen for a long time, it actually ended with her daughter actually killing herself, and she was 16. So she actually went through a long period of grief, and she had to take care of aging parents. And I did suggest that she go and see a psychologist. It was quite a difficult time, but her main concern is, how will talking to people help,
Yeah.
So what are your thoughts on that? A lot of people, especially in Singapore, we think, how can talking help?
I think, yes, you're right. There's a lot of misnomer that we just sit, listen, give advice, and sometimes patients will feel like it's generic advice that I can get on Google anyway.
Yes.
So maybe I briefly talk about what clinical psychologists do.
Yeah.
So firstly, we must take a holistic, comprehensive history of a person, because even though we have broad theories and broad intervention strategies, everybody is still unique with different types of resources, different types of personality, different types of upbringing, childhood, school experiences, relationships. All of this actually make us who we are and affects the way that we perceive the world, affects how we trust people, affects how we interpret certain things. So it's never an event that causes us to react a certain way.
Okay.
But it's about how we think about it that affects the way that we react. So I give you an example. 2 clients who have cancer. Same kind of cancer, same kind of diagnosis, but this client will take it very, very hard, and this client can take it in her stride.
Okay.
It's a personality, it's a resources, but it's also based on understanding how this person thinks about things. And I'll probably use this opportunity to share. As a trained clinical psychologist, you need a minimum of 6 years of study. So you must find someone with a minimum of a master's in clinical psychology with an accredited uni. So it's not anyone with less than 6 years and no masters. They may call themselves a psychologist, but they don't actually really have the training that is required to help you. So you need to find the correct professional in that sense. So what we do is we take this holistic assessment, and therapy usually happens in 2 ways. One is skills equipment.
Okay.
Right? So acquiring skills, you don't know how to manage your stress.
Yeah.
You don't know how to draw boundaries. You don't know how to say no. You don't know how to manage your in-laws, for example. You don't know how to manage your identity problems related to menopause. Don't know how to go to sleep. Skills acquisition. So we talk about strategies that work for you in relation to what I know about you. Right. So I won't really go and ask a high-flying career woman to say, oh, why don't you do cooking and plug tauge to manage stress? Well, actually, she never cooked. But if she did cook, then yes, we can use that strategy, right? But the other part that is more important is deepening the understanding of ourselves. And this is in relation to our childhood experiences. Because if you deepen your understanding of yourself, it would help you make decisions that are more emotionally congruent with what you want and more aligned with your own values in you becoming the person that you want to become. Okay. Right. So this is actually what we do. So there's always listening, but there's also a lot of reflection about why you have said that and what it actually means to you. I think in my work, I also help people identify their emotions a lot because Singaporeans are shockingly poor at identifying emotions. And a common example I offer is people may express anger at something and they think, oh, I'm angry. But actually, it's stemming from anxiety. I give you a simple example. My 4-year-old child refused to sit at the dining table. Climb up, climb down, climb up, climb down. And then I say nicely, please sit, stop climbing, please sit. Sit down, you'll fall, you'll hurt yourself, you'll crack your head. Sit down, sit down, sit down, sit down. Sit down! Right? And then, Mommy, why are you so angry?
Yeah.
Then it sounds like I'm very angry, right?
Yes.
Okay. But actually I'm very anxious. I'm so anxious that you're climbing up and down, you're going to fall and hurt yourself.
Yes.
And knock yourself and break something. Actually, it's anxiety. But if I'm not aware that I'm anxious, I cannot communicate that and I will end up reacting in a sit down. And then it will be, you're angry. And then I'm like, yeah, I'm angry. So when we can identify our emotions accurately, it will help to inform decisions or strategies that we can take that is more aligned with how we're feeling.
I see.
So a trained psychologist can help us do that.
Okay. I mean, it sounds like, for a lot of women I see, they are like high-powered super women. We think that we are very equipped with a lot of skills, but we actually don't have simple life skills or even to identify our emotions. So, maybe these kind of skills are quite important for us to develop, but how do we develop them short of seeing a psychologist, is there something that we can do so that we are more aware of our own emotions?
I think the first point I would recommend is post-reflection.
Okay.
To increase awareness of something that we want to change, first we must have intention that we want to change something, right? Okay. But sometimes the intention and the post-reflection will interweave. Okay. Post-reflection means, for example, I'm a full-time working mom, I work 6 days a week, and then I come home, I have less patience, then I lose it at my children very quickly. Then I have very intense guilt, right? Because I am the psychologist.
Yes.
And sometimes my husband will say, aren't you the psychologist? Wow, I think that would trigger me even more. I am also a woman, I'm also a person, okay?
Yes.
So I think post-reflection means at the end of the day, giving ourselves a bit of time to ourselves to kind of reflect on actually what were some of the behaviors or difficult moments in the day that affected me that I want to change and work on. Right? So when I reflect and I say, okay, I actually had a very full-on day. I rushed, I picked my kids from work, and then I just went into full-on mother mode. I have very little in me.
Okay.
My intention and my plan is I need to be more patient with my kids. I want to develop the value of patience and compassion, right? I don't want them to just model my screaming, right? Okay, how do I do that? Okay, after clinic, I cannot rush off to pick my kids. I must have minimally 15 to 30 minutes of alone time to potter around in the clinic, walk on my treadmill, look outside, drink a cup of tea, whatever it is, right?
Yes.
But I need to empty out the stresses at work before I hit go.
Okay.
So this increases awareness. Because this will have an impact on how much I have in me to manage them. Okay. And then tomorrow gets busy, bam, I'm running. Forgot. right? It's okay, because each time you post-reflect, you are actually building a neural pathway.
Okay.
Right? Because our automatic responses are automatic neural pathways that you will always take the same path. Right? And if you want to change the neural pathway, you have to work really hard at thinking about it.
Yes.
Wanting to execute it, trying to execute it, and reflecting upon it.
Right.
So when something goes wrong or you're reacting in a way that's not consistent with your values, reflect first.
Okay.
Be gentle with yourself.
Yeah.
At least you're reflecting, right? At least there's something you know you want to work on.
It's not unconscious.
Correct. Then you increase your awareness first. Okay. Then you must be committed. You need to be motivated and committed to wanting to make a change.
Yes.
Then each time you try. And when you manage to, even if it's a little bit, you must celebrate the wins. So last time maybe immediately shout at the child, right? But now, if I can tolerate for another 30 minutes and tell myself I'm going to walk away now because otherwise I'm going to start shouting. Yes. It's also in the moment changing your neural pathways.
Okay. Well, there's been such an interesting conversation. So if there's one tip you can give to our female listeners on how that maybe they can, empower themselves and live a better life, is there one tip you can leave them with?
Empower yourself and live a better life. Wow, that's a big one.
Yeah.
Better is different from other people. I would say be kind to yourself.
Yeah. Okay.
I would say it's really important to be kind to yourself, because I think the identity of women have changed drastically over generations and time. And women are now expected to do more with less resources. Yes. And we have also internalized expectations of perfectionism and success. Okay. And we want to tick every box. But I think being kind to yourself means being aware of where your limits are, and also being aware that you're giving up certain things to achieve certain things, and whether it's really worthwhile. So be aware. Be intentionally aware.
So we've come to the end. So thank you very much.
Thanks for having me.
Thank you. That brings us to the end of an incredible session with Dr. Annabelle Chow on lifespan of wellness, from period to pause. It was truly enlightening to dive deep into the complexities of menopause and explore strategies to enhance our well-being during this transformative phase. Dr. Chow's insights remind us of the power of informed choices, self-care, and the importance of approaching menopause with a positive and proactive mindset. If you have found value in our conversation and wish to support our mission to shed light on women's health and wellness, please take a moment to hit the like button and subscribe to our channel. Your engagement means the world to us and enables us to continue bringing experts like Dr. Chow to share their knowledge and expertise. So thank you for tuning in, and don't forget to subscribe for more episodes that empower, educate, and inspire. Here's to embracing change together and making the menopausal journey one of discovery and strength.